Welcome. Have you ever heard of chiasmal syndrome? It's a fascinating and often challenging condition that affects vision, and in this video, we're going to explore it in detail. We'll delve into what causes it, how it impacts the brain, the signs to look out for, how it's diagnosed, and what can be done about it. So, let's get started on understanding chiasmal syndrome. The primary cause of chiasmal syndrome is compression of the optic chiasm. This delicate structure is located at the base of the brain, just above the pituitary gland. It's where the optic nerves from each eye meet, and some of their fibers cross over to the opposite side of the brain. The most common culprit is a pituitary adenoma, a benign tumor of the pituitary gland. Other potential causes include craniopharyngiomas, meningitis, and even inflammatory conditions that can cause swelling and pressure in that area. Trauma is a less common, but possible cause as well. To understand chiasmal syndrome, we need to understand the optic chiasm itself. Nerve fibers from the nasal half of each retina cross at the chiasm, while those from the temporal half remain on the same side. When a lesion compresses the chiasm, it typically affects the crossing fibers first. This disrupts the information from the nasal retinas, which are responsible for processing the temporal visual field. Because of this disruption, the brain misses out on visual information from the outer halves of both visual fields. This specific visual field defect is what leads to the classic sign of chiasmal syndrome. If the compression continues, it can affect all the fibers in the optic chiasm and eventually, the optic nerves themselves, leading to more widespread visual loss. Chiasmal syndrome isn't considered a common condition, but it's not rare either. Precise epidemiological data is difficult to obtain because it's often tied to the prevalence of the underlying causes, like pituitary tumors. Pituitary adenomas, for example, are estimated to affect a significant percentage of the population, though many remain asymptomatic and are never diagnosed. Consequently, we can say that a certain fraction of people affected by pituitary adenomas may eventually experience visual field defects secondary to chiasmal syndrome. The condition can affect people of any age, but is often diagnosed in adulthood, as the underlying tumors tend to develop slowly over time. The hallmark symptom of chiasmal syndrome is bitemporal hemianopia, the loss of vision in the outer half of the visual field in both eyes. Imagine wearing blinders on the sides. That's essentially what it feels like. Patients may describe difficulty with peripheral vision, bumping into objects, or struggling with driving. In addition to visual field defects, other symptoms may arise depending on the cause of the chiasmal syndrome. For example, if it's a pituitary adenoma, hormonal imbalances might occur, leading to symptoms like fatigue, changes in menstruation, erectile dysfunction, or acromegaly. Headaches are also a common complaint, as is double vision diplopia, especially if the pressure is affecting cranial nerves that control eye movement. Diagnosing chiasmal syndrome requires a careful approach. First, a thorough eye exam is essential. This includes checking visual acuity, and most importantly, performing a visual field test. This test maps out the patient's peripheral vision and reveals the characteristic bitemporal hemianopia. If chiasmal syndrome is suspected, neuroimaging, typically an MRI with contrast, is crucial. This will help visualize the optic chiasm and identify the underlying cause, such as a tumor or aneurysm. Blood tests to assess hormone levels, especially pituitary hormones, can provide further clues about the underlying etiology. While not classified in the traditional sense, chiasmal syndrome can be categorized based on the underlying cause. For example, you could have chiasmal syndrome secondary to pituitary adenoma, or chiasmal syndrome secondary to meningioma. The management strategy will vary based on the cause. There might also be variations based on the severity of the compression and the extent of visual field loss. Some cases may be mild with only subtle visual changes, while others can lead to significant visual impairment. Treatment for chiasmal syndrome focuses on addressing the underlying cause. If a pituitary adenoma is the culprit, treatment options include surgery to remove the tumor, radiation therapy to shrink it, or medication to control hormone production. For other causes, like aneurysms or meningiomas, surgical intervention is often necessary. The goal is to relieve the pressure on the optic chiasm and prevent further vision loss. Visual rehabilitation may also be helpful to compensate for any permanent visual field defects. This may involve strategies to maximize remaining vision and use assistive devices. Since chiasmal syndrome is most commonly caused by tumors, particularly pituitary adenomas, primary prevention is difficult. Regular medical check-ups might help detect some tumors early, but there are no specific lifestyle changes or preventative measures to completely eliminate the risk. However, early detection and treatment of any underlying conditions, like pituitary tumors, is the best way to prevent or minimize the severity of chiasmal syndrome. The prognosis for chiasmal syndrome depends largely on the underlying cause. the severity of the compression, and how quickly treatment is initiated. If the underlying cause is treatable, such as with surgical removal of a pituitary adenoma, vision can often be recovered, at least partially. However, in some cases, permanent visual field defects may persist. Recent research is focused on developing more targeted therapies for pituitary tumors and improving surgical techniques to minimize damage to the optic nerves. There's also ongoing research exploring the potential for neuroprotective agents to protect the optic nerves from further damage during treatment. The earlier the diagnosis and the more effective the treatment of the underlying cause, the better the outcome for preserving vision.